We're here at the Colorectal Clinic on Collyer Street, right off the exit of I-95. We're going to go into our waiting room. I would like you to see how patients come in and how they go through this office and get cared for by the wonderful staff and our physicians. Well, this is our office and our patients, and patients will come up to the window and, hi, Shailene.
Hi.
And we usually have patients give their name and important information, allergies, medications, and then Shailene would then process with the rest of the staff back there. Tina is our office manager, and we have Myra and our other medical assistants that we'll see. So once that's done, follow me and we'll go into one of the patient rooms. In our office we have a room where we could do endoscopic exams, and this is our sigmoidoscope, and we could evaluate people with bleeding on the spot in a safe, painless manner. We also have other exam rooms that I'll show you, but first I would like you to see some of the secretaries. Great, Diane and Dee, you guys are doing a great job. These are our schedulers, and we try to call our patients back as soon as possible. And if there are any important messages, Diane and Dee will contact the surgeons to call the patient to take care of any problems. And of course, they also schedule patients for surgery, very knowledgeable. We have a wonderful staff. Have a great day, guys. Myra, we're going to schedule that patient for colon cancer resection. We found a colon cancer on colonoscopy, and the biopsies came back, and luckily for them, the CAT scan showed no spread, so we'll be able to do this procedure laparoscopically. I want to come in and speak to Jen. So Jen, I was telling Myra that we have a patient with colon cancer we need to schedule at the Miriam Hospital.
Okay.
And we're going to send you their name and the information, and we'll alert the hospital to what we need. And you do a great job in getting patients seen and getting them on the schedule. And of course, when patients call with problems, Jen is really right on spot and making sure that questions are answered and the proper care is given. So we'll get back to you on that, and have a great morning.
Thank you.
So now, Myra, when the patients are done, the medical assist like Myra will then bring them to the checkout. And the checkout area is very important because this is where the plans are sealed in terms of whether they're getting surgery, whether they're going to have a colonoscopy, and or whether they need any further visits. So we're going to walk to the checkout area. Here is our checkout area, and patients, when they're done seeing the physician, the MAs will bring them to the checkout counter, and Myra's here. The patients will make appointments to be seen again, or will be told about the operation and the date, and be given their instructions about any special preparations necessary prior to surgery. And so really thank you, Myra, for taking great care of our patients and answering their questions. I did see Dr. Shaw earlier, and he is with a patient, and maybe we could ask him a question about what he's going to be doing later today in the operating room. So this is Dr. Shaw, one of our 5 colorectal surgeons, and he just finished seeing a patient, and I think he'll be heading off to the Rhode Island Hospital for the operating theater. What's happening today?
Well, we've got a couple of cases this afternoon before the weekend, and we'll finish office and head over to Rhode Island Hospital to do that in a couple of hours.
Right. Any laparoscopic colon resections that you're looking forward to do today?
Not today, but we have got a couple coming up after the weekend. We as you know, Dr. Schechter, we do tend to do most of our surgery laparoscopically. better outcomes in terms of recovery, less pain, quicker return to work. And so we do strive to do the majority of our surgery laparoscopically, as long as it can be done safely. That's the main focus, obviously.
That's great, Dr. Shaw, and I'm sure your patients are so thankful for all the excellent care you give them. In our office, we have a nautical motif. We have pictures of beach, lighthouses, the shore, the ocean. When it comes to lighthouses, we know that they've saved a huge number of lives throughout the world for centuries. And we like to consider ourselves like a lighthouse, saving people's lives.